Ambercare provides a full range of home health care services, and today co-founder and veteran Mary Merrill is talking about the We Honor Vets program. So happy to have you with us. Good morning.
Good morning.
And I want to first talk, before we get to Catherine. Hi, Catherine. I want to first mention that you are a veteran of Desert Storm, and so we are so proud, especially to have you with us today. And so I want to know a little bit about your service with the Army.
Okay, thank you for having me, and thank you for thanking me. I don't think that we thank our veterans enough.
You're absolutely right about that.
When I first joined the military, I joined the Army, and it was mostly because I wanted a job. But then I got into the Army, and I started learning about our country, and I got very patriotic.
Yeah.
And then I served I never served overseas.
Okay.
Thank goodness I had little kids.
Yeah.
And my heart goes out to those people that have to serve and leave their children.
No doubt.
But I served at Fort Sam Houston when I was going through nurses training there.
Unbelievable. And so you really got an understanding for what people go through and wanting to help them. And so let me ask you, what inspired Ambercare?
Well, when I finished my nurse, I became an LPN in the Army, and then I came back and went to New Mexico State University, go Aggies, and became an RN. And I worked in the hospital, and nobody ever told me when I went in to take care of them, you know, I'd love to hang out for just a couple more days.
Right.
Everybody always wanted to go home.
Sure.
So I knew that there was a better way to take care of people than keeping them institutionalized, and if they could go home, they'd get better faster. So that's what we did.
Because so much is mental, so much is your mindset.
Yeah.
And so is that really what makes Ambercare more unique than other health cares? I mean, is that the biggest difference?
I think it is. We do a full range of services. We try to not put our people through too many, you know, hoops and bells and whistles. We try to make sure that they get the care that they need to get as soon as they need to get it, and take care of them and their families.
Okay, I see, and I love to hear that. And I just want to introduce Catherine. Tell us a little bit about yourself as well.
I'm the hospice administrator for Ambercare across the state. We have 8 sites all the way from Las Vegas, Espanola area down to Deming.
Oh my goodness. So, and I just love having the fact, you know, that you're doing something special, and it's not just the typical nurse care that we're all familiar with. There's actually a holistic model of care delivery. Can you explain that, Catherine?
Hospice care is really synonymous with holistic care because really we focus not only on the medical needs of our patients and their families, but also the psychosocial, the spiritual, and emotional needs that come with end-of-life challenges.
Sure.
And all of our hospice patients are facing a life-limiting illness.
Yeah, and there's a bridge model. Can you explain what that is?
What we do with our bridge model is we have actually 3 components to Ambercare. We have home health care, which is intermittent care. We have hospice care, which is end-of-life care. We also have a durable medical equipment side. So what we try to do is when people enter our system, we try to evaluate them and see where they are in the system. And if things get better, great, leave the system. But if things don't get better, we can move them into another area that's a little higher level of care. And the continuity of care, we retain that continuity of care, and sometimes they'll get the same exact staff all the way through. And I think it's helpful for the patients.
Yeah. Well, it keeps them in line with whatever's going on. Somebody's paying attention. I mean, that to me, whenever anything's going wrong in your health, you just want to know somebody is really paying attention and doing what's right for you, not the cookie cutter model of how things should be done, but what's right for you personally. And you actually do something really special. Catherine, I want to address this to you. What is the We Honor Veterans program?
We Honor Veterans is a collaborative program between the National Hospice and Palliative Care Organization and the Department of Veteran Affairs. It's a pioneering effort that addresses the veteran and family needs at the end of life.
Wow.
And Ambercare Hospice has partnered with We Honor Veterans in order to address those special needs in a holistic manner. So it's truly through respectful inquiry, compassionate listening, and also acknowledging their service to our country that Ambercare Hospice we're seeking to acknowledge and guide our veterans to a more peaceful ending.
See, I mean, and it's so important. And you know, we're talking so much today about how families are affected by what happens to those who are in service. And so, you know, to know that the family has somebody caring for the person who's fighting for our country, that somebody really cares. There's just a deeper level, and I love the holistic approach, because I mean, it is so much more than just give somebody medicine or put him in a hospital bed. I mean, there's so much going on mentally, there's so much going on emotionally, and so you care for people's hearts. That's what I feel like this is about.
We do, yeah. and we think that your home is the best place to do that, and we're very excited about the We Honor Veterans program, because we like everyone to know that we have heroes in our midst, all around us.
I love it, yourself included. And so let's tell our viewers how they can contact you.
You can contact Ambercare at 1-866-861-0060 is our toll-free number, and that's the easiest way to get a hold of Ambercare, because we are across the state of New Mexico, also at ambercare.com.
Yeah, and you can always get more details by going to the website. So I am so happy you both were with us today. Thank you. This is really special, and especially on a day like today where we get to honor our veterans. So thank you.
Thanks for having us.
Really, thank you so much, and happy Veterans Day to you.
Thank you.
And